Did you know that simple dietary changes can drastically improve the symptoms of the PCOS, including acne, weight gain, and irregular periods? Hi, I am Mahajan, a clinical and a functional nutritionist. I have helped a number of women to help recover their PCOS. PCOS is a common hormonal disorder affecting 1 in 10 of the women of the reproductive age. A key feature is insulin resistance, which leads to high insulin and it worsens the symptoms. And today we will discuss the role of diet in the PCOS management. So let's start with the root cause of this problem, which is insulin resistance. So what is insulin resistance? Insulin is a hormone that helps cells to absorb the glucose from the blood. In insulin resistance, cell stops responding to the insulin. The body compensates by producing more insulin. High insulin level is equal to hyperinsulinemia. So let's understand that how your diet is going to affect this insulin resistance. So there are a number of key features that we have included in our diet. Like first of all, let's understand what is the impact of the refined carbohydrates and sugars. Refined carbs like white bread, pastries, sugar drinks, they causes a rapid spike in the blood sugar. They increases your insulin level, which worsens the hormonal imbalance. For example, in many of the households, I have seen it as a common practice of having morning tea or coffee, and along with that, they will have a 1 or 2 toast or biscuits. Now, when you take tea or coffee in the morning, that will lead to the insulin spikes. These insulin spikes can affect your ovulation and even increase your androgen production. Even some of the people I have seen, they used to have sugary cereals for their breakfast. So that would also lead to the same kind of insulin spikes. Second, let's talk about the low-carb diet in PCOS. Low-carb diet does not mean no carbs, but limiting refined carbs and focusing on the complex carbs like quinoa, sweet potatoes, and legumes. How it helps? It reduces the insulin secretion and it improves your ovulatory function. For example, you can replace your white rice with quinoa, or even little millet can help stabilizing your blood sugar levels and improve your energy levels. Third, let's talk about the benefits of high fiber food. Fiber slows down the glucose absorption and improves the insulin sensitivity. It promotes satiety, so it helps in the weight control. You can include high fiber food like green leafy vegetables, oats, chia seeds, lentils, and flax seeds. Even you can start your day with a bowl of oats topped with the flax seeds and berries. Next is the role of intermittent fasting. Intermittent fasting, we usually have heard of 16 to 8 method, but for women, even 14 to 10 is a very good method to adopt and follow. Intermittent fasting helps reduce insulin resistance, inflammation, and supports hormonal balance. Fasting can lower circulating insulin levels and improve the ovulatory cycles. For example, women who ate between 12 p.m. and 8 p.m. and fasted for 16 hours, they show better blood sugar control and even weight loss. But here is a catch, this is not suitable for all. Those with eating disorder or who are underweight should avoid it, or you can do it under the guidance of a healthcare practitioner. So let's conclude and see what you take away from it. So number 1, you have to limit the refined sugars and carbs. Choose low glycemic whole food. Try to include more of fiber-rich meals. Try intermittent fasting if suitable. Remember, food is a powerful medicine. Small changes in what and when you eat can transform your PCOS journey. Like and share if you found this video helpful, and follow for more PCOS and nutrition insights.